is a video that circulated on social media of a woman who gave birth at the entrance of Edith Opperman Clinic in Mbari. That video got me thinking, it got me stressed, it got me frustrated, that I had to query with Dr. Chonzi, the Director of Health, on the ethics and standards that nurses in cancer clinics have to abide to. But it also got me thinking on how maternal health care issues are not being spoken about, and the less advocacy that we're having as Zimbabweans in regard to maternal health care. No woman should die giving birth. No woman should suffer like that whilst giving birth. And for nurses to actually refer a woman where there is no ambulance and expect her to go to the referral hospital whilst she was nearly giving birth is the highest level of inhuman treatment, which is degrading and totally unacceptable in our country. I know a lot of people didn't see anything wrong with it. But what kind of people are we? I'm just calling out to women out there. If it happened to her, it can happen to you as well when you're giving birth. It is time for us women to hold our hands together, rise up in our diversity and say we are going to fight for proper maternal health care in all government institutions, in all clinics, and ensure that every woman is comfortable whilst giving birth. It is a shame that the midwives and Ambuya treat women giving birth like dirt. Vanotuka madzimai. I once saw this when I went to Airport Clinic visiting some woman who was giving birth. I had to restrain some of the nurses and say, no, this is totally unacceptable. Nurses are supposed to be compassionate, are supposed to be loving, are supposed to provide hope. Not to treat women who are in pain, who are in labor, like some objects. What has happened to us? What has happened to our wound? My clarion call is to the Minister of Health, the Vice President, Mr. Chiwenga. Vakaberekwawo muri mwana. Ndiri kukumbirisawo kuti mugadzirise nyaya dzematernal health care mukati menyika ino. Kuti maternal mortality rates adzike. Muone kuti mudzimai wese anokwanisa kunobatsirwa, nekuti mutemo wenyika ino wakati madzimai anofanirwa kubatsirwa vana mahara. Izvozvi takabuda mucoronavirus period lockdown yekuti vanhu hobho havachisina pfuma. Inzwaiwo tsitsi semunhu akaberekwawo nemunhukadzi. Moona kuti zvipatara zvine zvikwanisiro zvakakwana kuti madzimai vagone kunobatsirwa zvakasununguka, zvisina marwadzo, zvese vachigona kunozvipiwa nehurumende yedu. Ndicho chikumbiro chandinacho kwamuri VP Chiwenga. My clarion call, Mr. Vice President and Minister of Health, please make sure that all hospitals have got sufficient equipment for childcare, for women in labor. That is critically important. We need to reduce the rates of maternal mortality, and we can do it if we are sincere about